Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. Please check out the website at I'm sorry. I just lost my place. I'm totally sorry. The website is lastemcells.com. That's www.lastemcells.com. And please call the program today and get your free book. The foreword is written by Suzanne Summers, and the book is called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. And our number right here in the studio is 866-870-5752. That's 866-870-5752. We are here Saturdays at 10 a.m. and again at 1 p.m., so listen up. And again, that website is www.lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. And right now, we are speaking with somebody with a thumb joint problem, and that's Trish.
Hey, Trish, Dr. Marc Darrow again. Hey, okay, I just wanted to lead into this because I have a little bit more to say to you. Number one, the work I've been doing my entire medical career is called regenerative medicine. I was doing it back 25 years ago at my residency at UCLA. A professor came in for a day and showed us. Actually, he got up there, told a joke. We didn't know who he was. He came as a visiting guy. And he told a joke, and then he said, I heal 80 to 90% of my patients with regenerative medicine. And everybody in the room, all the other doctors, were scoffing because they didn't believe him. They thought that surgery and medication was the only way to go. And I was the only one in the group. I was the only one in the group that perked up my ears, went to his office, and watched him do these procedures. That was my introduction. And then I injured my wrist, and he invited me to a national convention of regenerative medicine. And someone there injected my wrist, and it was healed 24 hours later. And it was a lingering, awful injury from hitting the ground instead of the golf ball. And hyperextended my wrist and probably tore some fibers. I'm looking at the wrist right now. There's a lump on it that you can see on the camera here if you're looking. And that is what happens when you have an injury like that. But the pain is gone. I mean, my wrist has been functional ever since. After the healing that took place at that workshop, I had to personally inject my own wrist a few times to get it 100%. But it's been good ever since, really. It's been amazing. I'm going to play golf later today. Those of you watching me on the camera can see that I've got my golf shirt and my golf hat on. And I have never had wrist pain. I can't remember the last time I had wrist pain. So that introduced me to it, and then it's morphed over the years from the older type of techniques, and now what we use basically are platelets from the blood and stem cells and platelets from the bone marrow. So it's been a great medical career for me. I've been doing this stuff almost 25 years, and it's worked all over my body. I've done my knees, my shoulders, my elbows, my wrist. I've had other people do my neck and back because I can't reach back there, and otherwise I would. It's hard for me to find somebody who knows how to do what I do. There are guys out there that do it, but they don't do as much as I do. I think I do. I've been told I do the most of anybody on the planet. So anyway, back to your thumb joints, the CMC, carpal metacarpal joints.
Well, how do you decide whether to do PRP or to do stem cells or something else?
Well, you decide. I just give you the information.
Oh, okay.
If it's something that you've said you've done PRP a few times, it didn't help, then you might want to jump into the stem cells. I don't know. I have to see it. Like I say, I don't trust most of the doctors that do this work. I'm sorry. It's not a put down on anybody. I'm not elevating myself. It's just that I do it all day long. It's all I've ever done. And most doctors who do it don't do that much of it. So you don't just go to a weekend workshop or go to a chiropractic clinic where they hustle all their patients to do this stuff and then bring a nurse in to do it, or bring a doctor in for the day to knock out a whole bunch of patients and he doesn't know what he's doing, or she doesn't know what she's doing. So, any doctor that you go to should be the guy who does the most. And when I refer people to other doctors, which I do all the time, for all kinds of things, I don't care what it is, I always send them to the guy that I know that does the most on the planet. I had a surgery years ago. It's called a pheochromocytoma. You'll never get that one. It was a tumor that produced adrenaline, and I looked all over the world to find the right doctor. I went to NIH, National Institute of Health. I spent weeks there getting tested. I talked to doctors all over the world, Germany, all over this country, and I finally landed a guy in San Francisco who had done over 300 of them. Every other doctor I talked to had done one or two or maybe a handful. And it's a dangerous surgery. If you pierce the tumor without having it encapsulated, the adrenaline leaks out and you die on the table. So it's a very dangerous surgery.
Yeah.
So I went to the guy that did the most. I was very confident in him, and I came out perfect. Okay? And then the interesting part was, he came to me right after the surgery, and I woke up and he said, "Get out of here." And I said, "What do you mean get out of here?" He says, "You've got to leave the hospital now." And I said, "What are you talking about? I can't move. I'm in so much pain." And he said, "I don't care. You go back to your hotel room and tough it out and come back 3 days later." He said, "I tied up that thing so good, there's nothing wrong going to happen to you. But if you stay here, you're going to get an infection." He said, "I've never had an infection in any of my surgeries with any of my patients because I kick everybody out of the hospital immediately."
Well, for something like this, is it done in the office? Like if you were going to inject?
There's nothing to it. It takes me a couple of seconds to do it. I do my bone marrows typically, unless there's a problematic patient that I have to sedate, it's typically, once I numb up the area on the pelvis where I get the bone marrow from, the procedure literally is 15 seconds.
Well,
and then when you go to, when orthopedic surgeons do it, a lot of them take you to a surgery center or in the hospital, and they sedate you or put you out. You don't need to do that. These are simple procedures. If you do enough of them, you know how to do it.
This guy wants to remove a bone from my joint.
No, that doesn't work.
I don't know which bone that is, but take it out.
That doesn't work. Yeah, probably the scaphoid bone. That's the one they remove the most. It's one of the carpal bones. Yeah, and then they
tie tendons together or something.
No.
Yeah.
If you're able to move that thumb, the chances are, I haven't seen it. I can't promise you anything even when I do. I don't promise anything to anybody, except I'm going to do my best and tell them the truth about how much of this stuff I do.
Right.
I do tons of it. I've done tons of thumbs. I do thumbs almost every day of the week, all the fingers. I just do it all. I do the whole body. I've used my own body has been the experimental guinea pig. I learned most of this on myself because no one was teaching it back in the day when I started doing it.
Right.
I had an intuition. I had an intuition, and I used that intuition to help me heal, and then I used it on my patients. After I'd heal, I'd go, "Hey, I did this on me. You want to try it?" And everybody was like, "Yeah, I don't want that surgery." And then it grew and grew and grew to my confidence level being very high. And,
Well, it sounds great to me.
Go ahead. So you mentioned arthroscopic, and I wanted to tell people what that means. Arth means joint, and scope, arthroscopic, means you stick a little camera in there. That means they're making an incision, sticking that stuff in there, and disturbing an awful lot of tissue. That's not what you do with your thumbs. That to me, This is not a put down on the surgeons. I love surgeons. They do the hardest work in medicine. Physically hard, physically demanding. They're brilliant guys these days. They're the top of their class. It's just that the culture of orthopedic medicine is surgery. It's changing, it's shifting, but it's slow. Medicine is slow to change.
It is.
The time will come. The time will come. I don't know if I'll be alive, but the time will come when they don't do these orthopedic surgeries anymore, when people and doctors say, what the heck were they doing back then? It was ridiculous. They were hurting more people than they were helping.
Yeah, we should live so long as to see that day come.
Well, it's coming more and more. I mean, more and more people are reading. They're listening and changing and telling their doctors they don't want surgery.
Mm-hmm.
And look, there's a lot of people that need surgery. Well, I don't think you need to. From what you're telling me, I think you're in pretty good shape. You've got some arthritis, big deal. And I think, regenerative medicine, you may need platelets, you may need bone marrow to get some stem cells and platelets in there. I don't know. But I'd have to examine you first. And I always tell people this. By the way, I get emails all day and all night long. I spend a good part of my day in between seeing patients when I wake up in the morning, going to sleep at night. I usually get to sleep around midnight or so or later answering emails because I get them from all over the world. And people always say, let me send you my MRI to see if you can help me. It means nothing to me what an MRI says. Nothing. Zero.
Right.
Unless I find a cancer or a broken bone or something like that, then it's important. I like to get those images because it's a safety net. But I don't treat based on an image. I treat based on an examination, touching the person, getting their history and all that. That's old. I do old school. Old school is what works. Well, most of my patients who have had a surgery, and obviously they come to me after the surgery only because it failed, I ask the question, did the surgeon touch you? And they look at me surprised and go, well, why would they touch me? They showed me on the MRI or X-ray what was wrong, and they told me I needed surgery.
No, I did. I paid attention to that, and I noticed that when I went in and met with this surgeon who wants to take the bone out and blah, blah, blah.
You don't take any bones out for your thumb pain.
He didn't even touch my hand.
Yeah.
Well, as you say. I'm sitting.
God bless him. That's all I can say. God bless him, because he's going to need a lot of love in his life.
Oh yeah, we had a very interesting conversation, but about other things too. But I won't bore you with that. I know you've got probably other calls coming in. So what I would.
Well, thank you, Trish. I think your call has helped so many people who are listening to understand that. Surgery can be done. It can always be done. It can be done after I do what I do and you don't like the results. You can always get surgery. But let me tell you something. After you get a surgery, it's more difficult for me to help you. I can, but it's way more difficult. If you take out the tissue and ruin the foundation of the joint or tendons or ligaments, it's real tough to fix that. Can be done,
no, I know.
But not always.
Drastic.
Yeah.
Okay.
So let me get to some other callers here, Trish.
Thank
some
you,
other
Trish.
people have been patient.
Well,
so I'm going to give out the phone number. If you guys want to talk to me right now, I would love it. The phone number to the studio is 866-870-5752. I'm going to repeat it. You can write it down. If you're driving, try to pull off the side of the road while you call in. It's 866-870-5752. And for those of you that don't have time to call in right now, but you want to catch me later, you can call the office at 800-300-9300. I'll repeat that for you. It's 800-300-9300. Or you can watch me do the procedures. I have videos of many parts of the body that I've done on my website, which is www.lastemcells.com, www.lastemcells.com. I'm going to talk to Wayne, who's got a hip pain issue. Wayne, how long has that hip bothered you?
Oh, it's been about, I'd say about 2 years.
Okay. And did you go to a doctor yet about it?
I've gone once to my GP, and he took an X-ray and determined it was arthritis.
Okay. And what did he tell you to do about it?
Wait. Didn't he thought ultimately surgery someday, but he didn't think there's any hurry.
Okay. So I hear this all day long. It makes me sick. Okay? Why is the doctor going to tell you you're going to need surgery someday?
Yeah.
What does that do to your brain and your consciousness? It sets you up for failure.
Yep. And it sets you up for constant worry.
That's it. Depression, worry, and misery. So,
yes.
I always admonish when I teach to doctors, I tell them, be careful what you say to your patients. They're going to trust you. And what you'll hear me say most of the time to my patients, because they come in often in tears, saying things like, I went to 3 surgeons. They all said I need surgery. And I go do an examination. I start laughing. They go, why are you laughing? I go, because you don't need surgery. And they go, I have bone on bone. I go, you don't have bone on bone. We're moving that joint around. I watched you walk in the room.
Mm-hmm.
So, doctors need to be taught more about how to take care of people, make them happy, not how to make them miserable. And the old form of medicine, what we call traditional medicine, personally, I think it sucks. I shouldn't say that on the radio, but that's my opinion. I think it sucks. I think the training is terrible in the medical schools. It's based on, quote, science, which I don't believe in. I believe in doing things empirically. If it works, do it. I don't care what the other doctors say about me. Okay? It doesn't bother me a bit, because I knew I'm doing things for the good of the patient. And I'm willing to step out of the box to help people. And when someone's stuck in their little box of you got to do surgery and you got to take medications and all that, that really burns me up. I'm sorry. I don't mean to be on a soapbox
for
to you.
a short time last Christmas, the leg got really painful, such that I couldn't move the leg, particularly laterally. It was crossing my legs, for example, was almost impossible. And that got worse, and that severe pain went away.
Right.
I don't know if that's related or not.
Well, I don't think it is related, because you don't have that today.
Yeah, probably not, huh?
So I'm going to tell you a story, okay? I run my body pretty hard. I need sports to feel good. I'm one of those guys. So obviously, guys like me get pain all over the place. Most of my pain goes away. So I was running, I shouldn't say this because my wife might listen to this show. I was running one of my huskies, Bella, yesterday. I live in the mountains. And all of a sudden, my right hip, I don't know how to describe it, but, people would say something like it seized up on me. It didn't seize up on me, but it got really, really painful. And I had to limp for the next mile to get home. Okay? Did that bother me? Nope. Because I'm used to it. Now, if I was a dummy and I went to an orthopedic surgeon and I told him about that, and he did an x-ray and he saw some arthritis, what would I be told?
Surgery.
Yep. But guess what? I woke up this morning, I'm completely pain-free. Okay? I'm going to go play golf now. So, do I have arthritis in my hip? Nope. I've looked. I've looked with an ultrasound. There's no arthritis there. Do I get hip pain once in a while? You bet I do. Do I get shoulder pain once in a while? Excruciating. You bet. Wrist pain? Sure. Fingers? Oh, yeah. Elbows? Yeah. Neck? Back? Sure. Feet? Toes? You bet. Does it bother me? No, because it's not related to a pathology of something wrong. It's just overuse. But when a person who has some of these overuse things or has a little arthritis goes to somebody who does surgeries, the surgeon puts 2 and 2 together and it equals surgery. But it doesn't really equal surgery. 2 and 2 doesn't equal 5, 5 being the surgery. So most of these things we can heal using cells from your body that regrow the tissue. So you have to be careful. You can have arthritis. There's people all the time that have arthritis and have zero pain. How do we know? Because we do studies with them. We take people and we say, how many of you don't have pain? They raise their hands up. We get a group of them, we do an MRI. We can do an MRI of the whole body because it's just magnetic energy. It's not X-ray. It doesn't hurt them. And guess what we find, Wayne? We find herniated discs in the back. They don't have back pain. They don't have leg pain. We find arthritis in the joints. They don't have pain. What does that tell you about the MRI? It's a big liar.
Yeah.
And surgeons use the images as a reason to operate. Bad reason in my book. Not a bad surgeon, not a bad person. Could be the best surgeon in the world. I love surgeons. I did a lot of training in surgery, and doing surgery is not only hard physically, you're on your feet all day long, it's exhausting, but the results just don't come out that great. The surgeons are amazing, but the surgeries aren't great. Do you understand the difference?
Yes.
So, you're a classic example. You had some severe pain in your hip. Your doctor said eventually you're going to need surgery, but today you're pretty good. We have people call the show all the time. I'm doing too much talking today, not listening to callers. I'm sorry. But we get callers all the time that go, God, that's my story. I was told 20 years ago I had to have a surgery. I never had it, and I'm fine. Anyway, Wayne, if you ever want to come in, the phone number to my office is 800-300-9300. And I would love to see you. For those of you that want to call in the show, you'll get a copy of my book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate.
Yay.
It's full of studies about how this stuff works and how the surgeries fail. There's like 250 studies in here. The reason I did this book is because I used to lecture at hospitals to doctors for their continuing education. And at the end of every lecture, there were always a couple of orthopedic surgeons who would stand up in unison and go, hey, where's the research? So I got the research. Now I hand them the book. Go read it.
Okay, let's go to Harvey in Los Angeles.
Harvey, Dr. Marc Darrow, how are you today?
Well, good morning, doctor. I'm calling to ask if you have a protocol to treat a Morton's neuroma.
Oh, yes, I do.
Oh, am I happy to hear that? Because
do you want to tell us about what you're experiencing?
So severe, I can't go out and enjoy walks in the park with my dog, let alone play.
Okay.
And of course, we're at the point now he wants to do surgery.
Don't do it. I got an answer for you. Just go to my website and you can get a hold of me there. There's an email on every page, www.lastemcells.com, and I will get right back to you, Harvey, I promise.
Okay, thank you for listening, everybody. Thank you, Alex. Thank you, Dr. Darrow. Thank you, Suzette. Listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday. Thanks for listening, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.